Hello, my name is Aisha Salimi, and I'm a pharmacist advisor working at UCLPartners Academic Health Science Network. In this short video, I'll be talking about the roles included in the wider workforce, why we're encouraging mobilization of these roles, what tasks we envisage these roles to carry out in order to implement the proactive care frameworks, and the resources that we have produced to support this. There are many roles that can be considered part of the wider workforce. However, in this video, I will be focusing on healthcare assistants, health and well-being coaches, pharmacy technicians, social prescribing link workers, care coordinators, and nursing associates. Utilizing a wider workforce is part of the 2019 NHS long-term plan and is a core element of UCLPartners proactive care frameworks. It means that GPs can then focus on providing high-quality clinical care to often very complex patients with multimorbidities. It will also improve the care that is being offered to our patients. With appropriate training, these roles will have more time to provide personalized care, support education, self-management, and behavior change, as well as addressing patients' wider concerns and signposting to relevant clinical staff where necessary. It's important to note that members of the wider workforce are integral in ensuring that high-quality care is delivered to all patients all of the time. By taking the time to carry out important tasks, such as reviewing lifestyle, patients will be given the space and opportunity to explain areas of concern and why they may not be making the behavior changes that they would like to. Some examples of tasks include running searches to identify the patients that need reviewing, carrying out proactive care consultations, which would include discussing lifestyle and behavior change, explaining inhaler technique and how to use blood pressure machines. And please note that there are resources available that will demonstrate these skills. Also signposting to more information, listening to patients' concerns, and referring to the clinical team where necessary. So let's go through a quick example. Here we will discuss implementing the hypertension framework and using that for a patient with high blood pressure and cardiovascular disease. Before implementation, review the slide on recommended training for healthcare assistants, social prescribers, and other members of the wider workforce, and ensure that this training has been completed. Once a clinical lead has signed off a member of staff in the wider workforce as competent, the next steps can then be taken. Ensure that the searches have been requested and sent from UCLPartners. Please note that the searches will come as zipped files, and these need to be unzipped by right-clicking on the saved file and clicking unzip or extract all. You can then save the unzipped file. The searches can then be imported and run. We recommend that you watch the video from the UCLPartners website on how to import and run searches before doing this. The patient list is now identified and stratified into 4 priority groups. All of these patients will require a call for lifestyle and behavior change, and so you may want to start with the high-risk group first. Use the cardiovascular disease protocol, also known as the multimorbidity protocol, to guide your consultation, and consider having a more experienced member of staff with you for the first few calls. As the patient has cardiovascular disease, they will also require information on managing their cholesterol level. Document the consultation on the GP IT system using a pre-developed template and ensure any follow-up tasks have been documented and scheduled for an appropriate time. One of the clinicians can then complete a clinical consultation for this patient. So the example that was just given was around tasks that would be completed by an individual. Implementing the proactive care frameworks on a wider scale will require some more planning, and mapping the workforce is a good place to start. Consider the staff types and numbers that you may require to implement the chosen framework or frameworks, and map that against the workforce that is currently available. Complete a training needs analysis for the staff members who will be implementing the frameworks. And just as a reminder, UCL Partners have developed a slide deck with recommended training for different staff groups that may be helpful to do this. Finally, consider utilizing staff members across practices within the same PCN to fill any identified gaps in required workforce. UCL Partners have developed several resources to support these roles, including recommended training for the wider workforce, a video on how to run the searches on EMIS and System 1, protocols to guide the proactive care consultations, which are detailed scripts, digital resources for cardiovascular disease and respiratory conditions, and health coaching, motivational interviewing training as well. I hope that you found this video helpful. If you have any queries, please do email us on primarycare@uclpartners.com. Thank you.